Hello, I'm Dr. Kaylin Lane. I'm a psychiatrist currently practicing in rural South Georgia. I'm board certified in general psychiatry, child and adolescent psychiatry, and forensic psychiatry. I currently work as the medical director for Unison Behavioral Health. Unison is a community service board based in Waycross, Georgia. We provide services to individuals with mental illness, substance use disorders, and intellectual and developmental disabilities. In addition to serving as medical director, I also provide direct patient care to our clients. This is done almost exclusively via telemedicine or telehealth. Today, I will be discussing autism spectrum disorder and the use of telemedicine. The objectives in this presentation are to discuss ASD-related clinical challenges and options for overcoming these using technology, including online resources such as telehealth. So, clinical challenges. We only have so much time in the day, so I've chosen to list just a few. Number one, identifying different presentations of autism. Number two, finding solutions to co-occurring medical presentations and treatment. And number three, coordination of multidisciplinary care teams. In my opinion, number three is actually the solution to number one and two. So challenge number one, identifying different presentations of autism. Why is this a challenge? It's in the name. Autism is a spectrum. If you've met one person with autism, you've met one person with autism. At the opposite ends of that spectrum, there are individuals on one end who are nonverbal, severely developmentally delayed, and intellectually disabled. At the other end of the spectrum are individuals with IQ in the superior range, no language or other developmental delays. There are frequently common comorbid mental health conditions, and any of these can camouflage or even mimic autism. These include the other developmental disorders, intellectual disabilities, communication disorders, ADHD, etc., anxiety disorders, depression, mood disorders, and disruptive behavior disorders. Many genetic conditions can present similarly to autism. For example, Fragile X is the most common cause of inherited mental retardation, intellectual disability, and autism. It's the second most common cause of genetically associated mental deficiencies after trisomy 21 or Down syndrome. Rett syndrome, Down syndrome, Prader-Willi, and Williams syndrome are just some of many genetic conditions that can often present as autism. On a side note, I wanted to point out that in Rett syndrome, there's not always a textbook presentation. I had a young lady in my private practice who was eventually diagnosed with Rett syndrome, but she did not have the typical genetic mutation that is associated with Rett, leading to a delay in her diagnosis. Challenge number two, finding solutions to co-occurring medical presentations and treatment. Well, why is this important? Again, there are many medical conditions that are associated with autism, epilepsy, sleep problems, and constipation, as well as increased likelihood of various other physical health conditions in individuals who have autism. Those include asthma, eczema and skin allergies, food allergies, headaches, and gastrointestinal disturbances, including diarrhea and colitis. Challenge number three, coordinating multidisciplinary care teams. Why is this important? Well, as I mentioned earlier, in my opinion, this may be the solution to challenges number one and number two. So as we've just discussed, identifying autism, which can present in varying ways, can itself prove challenging. Many individuals with autism have comorbid mental health and physical health conditions, and as the saying goes, it takes a village. So forming a team for assessment and/or treatment is key. Given the complexity of these individuals and the likely need to involve many specialists, using telehealth resources may be the only way to coordinate assessment and treatment amongst all of the pertinent professionals who are likely in multiple different locations. So now I just wanted to talk briefly about some lessons that I've learned in practicing by telehealth almost exclusively for the last 6 years. One is the more sources of information, the better. One of the benefits of working by telehealth is that you can frequently have other people involved in the appointments, people who otherwise wouldn't be able to make it to your office for an appointment. These might include teachers, guidance counselors, daycare staff, or even other relatives. It's always helpful to have an extra set of eyes looking at the situation. Keeping children, particularly those with autism, in their usual routines and familiar environments is key to reducing their distress. No one likes to have to take a long drive to get to see a specialist, especially not a child with autism. The other thing that I've found is that some people, particularly individuals with autism or extreme social anxiety, will actually talk more to you when you're not in the room with them. Several years ago, after I evaluated a young man, he was about 16 years old. At the end of the appointment, his mother turned to me and said, "We've been seeing therapists and counselors since he was a young child, and I've never heard him talk to anyone as much as he's talked to you." Not to say that I'm any different or any better than any of the other professionals he'd seen, but I was the first professional he'd ever seen via telemedicine. Other things to consider when using telehealth or telemedicine. You have to think about your familiarity with and your access to technology, as well as that of the patient. Telehealth equipment, electronic health records, or lack thereof can make or break a telemedicine practice. Confidentiality can be a challenge. It's important for us to ensure that our patients' privacy is protected and that they're in a location where confidentiality can be maintained. As one might expect, many people are more at ease in their own homes, and when possible, conducting telehealth appointments to individuals in their own homes can be very helpful. This also gives the clinician a glimpse into the living conditions of our clients. I want to thank you for your time. I hope you found this presentation helpful. And if you don't remember anything else, please remember, time is brain.